Hey everyone, we're back with one of our first sponsor presentations of the day. Really excited to introduce you guys to Sarel of Illumin. If anyone has ever booked a meeting with me ever in the past few years, you guys have seen this really cool slide that I use and that our team has provided me of a DSP that has a canvas-based buying. So kind of dragging, dropping, creating user journeys, a really, really unique point of view on propensity modeling, on building journeys, on really understanding how the patient flows through different types of touch points, different mediums. And so I won't take all of Sarel's content here, but Sarel, why don't you go ahead and introduce yourself? I know you've brought Michele from UCDavis Health. We'll give you guys the floor and let you talk about yourself and the work that you guys have done together.
I appreciate it. Thank you so much. First of all, it's great to see everyone. It's such a pleasure to be here. And I actually do really want to start with thanking the Cardinal team, Alex, you, phenomenal conference so far. We all really enjoy it. I get a lot of text of people that are really enjoying enjoying the conversation. With me is Michele Murphy-Tabor, an amazing human being that in her title at LinkedIn, it says, the only way to do great work is to love what you do. And one of the first questions that me and Michele were talking is how much she loves her team and how well they do with so much less. Michele, you have years of experience in the healthcare, in the creative side. What was so interesting to us and to have you as an honor to join here is you have both experience on the agency side and on the brand. And that is just a wealth of information and data to help you better planning and get more from your money. If you don't mind giving like one or two a quick bio on you and to go straight into the question with cutbacks and less people, how do you achieve so much with this incredible UCDavis Health?
Good morning. Thank you for inviting me here. Michele Tabor, and I'm the Director of Brand Management and Marketing at UCDavis Health. It's actually the first time that they've had somebody overseeing brand. So they've had a marketing person before. So 7 years ago, they really started focusing more on brand. And before that, I was in the agency world for longer than I care to admit, but a long time. So I think it does bring a good deal of perspective to my current role. To say it's a culture shock going from an agency into a large engine like the University of California certainly cannot be overstated. That there's a lot of differences in how things are done. But I think that perspective has helped a lot for our team to find success. So I restructured our team much like an agency model, simply because I needed to see the efficiencies and the organization for myself to feel comfortable in the role and to see the goals, to be able to achieve the goals that we had and move at the pace that I knew it was possible for us to move, but currently wasn't happening. So restructured into, a creative design team, a writing team, formed the analytics team, and then the marketing specialists and media, kind of layered on top of that, as well as administrative support. And I don't love the word, but systematizing things has really helped a lot. So using tools available and integrating them into our team to find those efficiencies has been just really crucial.
What would you consider an ideal partner? First of all, from a goal perspective, you are managing, so many different departments, right? Like you're managing the graphic design, the contract development, the photographer, media specialist, marketing specialist, analytic, administrative stuff. What would you focus on, and how do you plan better between a digital campaign to an execution?
Excellent question. We're all so busy in these roles, marketing covers so much. Any partner that I work with, they have to have excellent customer service. I think that's just, a basic foundation. And by that, I mean that they have to communicate well with you. They have to use their tools and be very familiar with them so that if you have a question, it's very quickly answered. Ideally, a partner is proactive, so they will identify a situation and bring it to my attention before we're poring over dashboards and noticing it ourselves. And identifying it and proposing solutions or recommendations as well. I think that goes hand in hand with bringing new ideas to the table. I think we have a robust team, and we certainly bring a lot of ideas with us as well. But having this perspective from outside the organization that can come in and provide a level of understanding, so taking the time to understand us well enough that they can come in and make some, additional recommendations and fresh ideas with a different perspective.
Right, and probably everybody here on listening was like, oh my God, that is exactly what I'm facing, because we are facing it too. We are a DSP. There's just like like any industry, there's a lot of competitors, and we are not the trading desk or the big gorillas that like having a kind of like contract with the big agencies. So for us, it's a lot, probably like you, a lot about trust. Like it's testing, it's making sure that the proactivity is there, that the performance is there, the analytic is there. And what we are trying to also focus on is, from an ideal partner, tell me a problem that I can help you solve. Focusing on everything is sometimes not as good for us as focusing on like one thing that we can really focus on fixing. Because with our platform, as you saw many times on the demo, we are a canvas that run a journey and connect between all the channels together, from the upper funnel to the mid funnels to the lower funnel. But as long as the client is telling us specifically what is the goal and we are setting expectations correctly, we will always be able to bring a lot of data back to the table. Looking at data perspective, what are some of the unique data that you are looking to find when you're running digital campaigns? And what are kind of like ideas that you wish you had in a perfect partner?
Oh goodness. Data is always the toughest thing. In an organization like ours, getting the return on investment, like looking at the data on our side of things, is really, our biggest challenge. So unlike buying a widget, healthcare is very different. It's the actions are, we either want them to call or click or fill out a form, whatever it happens to be, to convert them. But ultimately, yes, that's good. But ultimately, we really want them to make an appointment, get a service, and perhaps depending on what the goal of the organization is, it might be capture capitated lives, for example, long term have that patient for decades, essentially. So getting that full data set from the initial campaigns is excellent, and we do need that. But understanding from our own organization and how to pull that in and tie them in together to see what our true impact is really what we've been working toward. And I partner up with our strategy team and their analysts on strategy a lot to do the best we can with that.
I love that. Red tape, if you don't mind talking for a second about, like you have a large organization. We are only 300 employees, 280. I run the US, so it's easy for me to make decisions and to help the client as much as I can in a minute. And like, when the client is asking something, I'm always available on my cell phone. UCDavis Health, just like I don't know if you guys all know, but like 10 Olympic medals, 2 Nobel Prize, field medals, 3 Pulitzer Prizes, and so many other prestigious honors. Large organization, red tape there. When you want to be creative and change things, how easy it is for you to get things done, and what would have been easier for you if you could have looked at something that, like, I wish I could make that quick switch.
Oh, yeah. I mean, the hardest thing is to bring on, honestly, to bring on new systems and new vendors because it requires, we're looking at HIPAA compliance. It has to have IT evaluations. It has to go through procurement. In instances like our agency of record, we go through a full RFP process. There are benefits and there, are pitfalls to that. The RFP process is great because it allows us to dive really deeply when we're assessing these vendor relationships, which I think has a lot of benefit to it. We have a very robust RFP process, so we can get a lot of that information and have a lot of touch points with the prospective new agencies. And so by the time we end up completing it, I feel very confident in that selection. It's really forced us to take that time to do that. Of course, the downside of that is it's very difficult to be nimble on smaller type projects and things that you have to integrate. Certainly have, I think, streamlined it, as best I can. But I always try to take into consideration too, like I'm trying to be a good steward of our resources, and we don't have the budgets of the big guys. So I really have to make sure that I'm being very mindful of anything that we're investing in and directly correlating it to a goal for the team and the department.
Right. Like in the end of the day, okay, I'm willing to test, I'm willing to go through all the Michiganese of like placing the pixels and getting everything done in IT and so on. But in the end of the day, my main goal is my goal. And I always need to put a focus on because my budget is limited and I need to be creative.
Right. And we can't place pixels. So
Mm,
we're
wow.
very conservative in how we are tracking things. So there's just so much at play. We're also work very closely with, like IT and the web team and things like that, because so much of what we do is kind of integrated in other teams as well.
Is it true that you guys have the bicycle capital of the US? Like that is like very bicycle
I
friendly?
think the Davis campus that's what I understand. Yeah. The university sits in Davis and the medical center, so we have a second campus, sits in Sacramento, which is where the medical center is, and Cancer Center, Children's Hospital, and surgery centers are all within the Sacramento campus. Yeah.
Mhm. Um, as I said, you have a lot of experience from both sides. If you don't mind touching for a second from the creative perspective, especially when you were a CMO and like from a creative perspective agency, how do you utilize creative well? What are you looking for when you're building creative? Like, what is the message that you really want to like, bring into the table when you're like building it and executing the buy?
That's a great question and something that I think as marketers we grapple with all the time. So designers are wonderful, creative, our art director spectacular. Um, Always have to be mindful of we are not here to just create beautiful art. I mean, that's wonderful. But what we're trying to do is really support that brand experience. And so everything we do has to have that additional layer of evaluation and look at it through the lens of our brand overall. So it has to be supporting the brand, in some instances, elevating the brand depending on who we're targeting with it. And so we really have to take a hard look at everything that we're doing and seeing if it's hitting the brand goals. And then secondarily, what is the campaign? Is it for the School of Nursing, which is going to be, a different audience, for example, other than a patient or direct to physician audience, which would be referral. So what are the goals of the specific campaign and looking at it there. So we develop really robust personas and we just revised all of those and tried to develop all of the content assigning that persona to them so that everybody can kind of take a moment to think and say, all right, this is the persona that this is most closely aligned with. What social channels are they more likely to be on? What are the things that are of interest to them? So for example, we're choosing imagery for a digital campaign as it relates to a pediatric type product service, let's say. So we know those are, those can be moms. They tend to be a caregiver mom, let's say, for example, they're into do-it-yourself projects. Maybe they're likely to have a pet in the home, so you include a family with maybe a pet in the image. So really taking the time to dig a little bit deeper and really assess which persona and identify key items that would be most important to them, and including that in the campaign, whether it be in content or imagery.
Wonderful. You guys just changed agencies, right?
We did.
Agency. What made you guys decide to make the change? How do you make a decision? You know, is it hard, the switch between the two agencies? Tell us a little bit about it, because I know that you wake up at 5 in the morning every day to talk to physicians. So imagine that for you to go and change another agency, you know, is not an easy task to do, right?
It is definitely not. And we, end of last year, we put out the RFP, and then we switched over to BVK this year. They've been a great partner. It is a massive undertaking to do the RFP. It takes several months, and it's not only a lot on our team, it's for those that are participating in the RFP as well. I understand it's a big commitment for them to do it. We take it very seriously. And the transition time, once we do select someone, is very challenging. I would say for our media specialist, it's twofold. It's onboarding the new agency, but it's also offboarding the previous agency, and then finding that transition time kind of in between for all of the campaigns that we have going. And there are so many going at any given time because we cover so much. That transition takes, I would say, from March to 5-6 months, the onboarding and offboarding of the previous
Wow.
one, just to make sure everything is properly done, dashboards, data's
And
moved.
every year you have to review, because the biggest
Yeah.
funder for you guys for research is the federal government, right?
Yeah.
So do you have rules?
So we don't do a lot in terms of the marketing support for the research arms of things. We do a little bit support of them. So we're not our budgets aren't quite as volatile as that. And we don't go out every year. So we have the option to renew. I think it's up to 4 years or so. Generally speaking, 4 or 5 years. I'd have to go back and read our contracts. But I think generally speaking, we go out to RFP and start a new process somewhere around every 3 to 3.5 years. We certainly have the option to go longer. I just feel in terms of being a good steward of university resources, it makes sense. And we should make sure that we're always finding the best value for the organization.
Okay, I would like to recommend you on an amazing agency called Cardinal Health, but that's just aside to the local bank. Okay. They're actually really intelligent and smart. And they're on top, you know, sometimes you work with a client, and just like you, how you said, I love my team. I adore them. There's no one I want to replace. I just need to get more because I have cuts all the time. It's the same thing with Cardinal. On top of their stuff, working really hard, making sure that everything is there. So just, you know, for the next review.
I appreciate that. Yeah, I know finding the right team is key, whether it's in-house and your external agency. I've been very fortunate. My in-house team is spectacular. They all work so hard, and they're also dedicated and really on board with our brand and supportive of it. And they all, I think, do the best certainly they can with the resources that we have available to them.
Well, it says that it starts with the top, so that's probably usually it's trickle down, right? You know, so you have a dual perspective from an agency perspective and being in the brand perspective of, like, you know, executing a buy. What is the key ideal partner when you're working with someone, other than the performance, other than executing the buy? Is there anything else that we can learn from you on being on both sides? When you wake up in the morning, planning for next year, planning for the quarter, how many programs, by the way, you're running on a regular basis? Because there's a lot of different programs.
Oh gosh. It depends on, I would say a dozen, and then within there, like a search platform has another dozen layered nested
Wow.
underneath that. So it's a very
Wow.
complicated system for us because it's, as a health system, it's your primary care, it's your cancer center, children's hospital. We have specific service lines. We have a school of medicine, school of nursing. So there's lots of layers in there. It's definitely not an easy, we're not an easy client for any agency to work with, for sure.
Mhm.
What we're looking for when we're looking at our media buys, for example, always want to find some new ideas to integrate. So when I'm talking about like our larger campaigns, let's say open enrollment, there's other healthcare folks on here. Open enrollment's a big one. Brand campaign's a big one. Those are probably the two larger ones. Always trying to identify what are some new opportunities for us. Sometimes it's digital, sometimes it can be very boots on the ground. We did a few years ago, like sunblock stations in communities and things like that with big activations. But
Wow.
trying to bring new ideas to us and then working with the agency to really, find out, okay, how much of our budget do we allocate for each of these, always trying something new on what launch of one of these newer campaigns, and then, of course, at the end, assessing the efficacy.
Wonderful. I got a lot of messages of like 3 decades of knowledge on both sides. Please, we want to learn as much as we can from Michele. So I appreciate that. Anna is having a question which is so interesting because when you were talking about the persona and building a persona, how do you build a persona first of all? How do you actually like get into the tunes of the persona? And Anna is asking, how often do you update it? How often do you refine it?
Yeah. That's a great question. I would say about every 5 years, 4 or 5 years is how often we're updating them. It's all based on our data. Huge fan of a lot of research. So we do a lot that feeds into this, depending on persona, whether it be for the health system, for schools, school of nursing, school of medicine, or whatnot. It could be focus groups, it could be surveys. We do consumer market insights every year following up our big campaign. We work heavily with NRC and do personalized questions that we run every month, and we update those. I also do on-demand studies with them and use that data to then help feed into what's used to update our personas. And then we partnered in this instance. That was the first project of the new relationship with BBK, and partnered with them to help us update. And then they brought their data sets into that as well to help us really refine each of the personas. And we expanded our personas as well on this current update to better reflect the changing priorities of the health system. So for example, recruitment, just overall, right? Everybody knows what shortages we have. That's been an increasing priority for us. That really wasn't reflected 5 years ago. So it is now in the personas.
So enrollments and all these like other programs that you have, most of them in the end of the day come to like a specific goal, like a paid media goal, right? Like some kind of a correlation to enter something in the system, or like foot traffic into to learn more, read more, understand more, fill up a form. Do you agree with that? No?
Oh yeah, we don't do anything without a goal.
Right.
Even a brand campaign has a goal. It's to improve our brand metrics, whether it be however we identify it in the creative brief, typically for brand, like it would be NPS, loyalty, preference, something like that.
Okay, so if there was a new channel that you would want to test, or that you actually want to see if it's actually working in more from the branding part, like that will take time until we actually see new users actually learning about it, coming in, watching a video, but then slowly getting them to the low funnel.
Mm-hmm.
What do you find working? Or Joe Monaco is asking, what would you wish to actually test if you could as a new emerging channel?
That's excellent. I would love, so what I find that we're working, the programmatic is working really well for us. Video is performing extremely well. The challenge
What does it mean performing? Full complete video?
for full complete video and for the action. So if the action on that would be, let's say it's School of Nursing, they're clicking through to
Okay.
the information or form
Uh-huh.
in particular for them. When it's the hospital, it could be clicking through to our choose during open enrollment, how to choose a new provider and call into the call center there. so it depends on that. And so the programmatic is where we're really, you know, leaning into, and there's different partners and different avenues and different options. We'll try different things. Like we tried the ones with the OTT, where you can scan the QR code on the pause button, I think maybe a couple of years ago during open enrollment. Wasn't great. Like it didn't work really well for us. It wasn't a lot of people converting over to going to the site from there. I was happy I tried it. It's always good, but finding that sweet spot of how much we allocate to trying and investigating these new opportunities.
Okay, so from the total budget, how much would you say is kind of like divided between different channels? Like how much is going to search, how much social, how much programmatic, display, video, and so on?
Oh, that's a good question. I don't have the pie chart right in front of me. I can tell you that the more traditional mediums are in the pie chart are certainly getting smaller because we can get, you know, more specific data. The programmatic has definitely grown, and social, you know, as well. I think paid social has been particularly effective for us. Partnering that with the programmatic, those two kind of really working in tandem, I think have been our strongest performance. And like I said, I'd love to lean more into video. We need to find a way to get more video assets and production on them. So definitely heading into the new fiscal year, that'll be one of my focuses.
Do you have a lot of like, I wish I could try this social platform, but they're not HIPAA compliant, so I'm not allowed to run them, or it's going to take me like a year and a half until I get it approved? Does it happen often?
It doesn't happen often. I mean, there are things where I would wish that we could hop in a little bit more and try some things. Because we're not as nimble. I understand that our social media team, you know, has limited resources just like we do. I see conversations, for example, on Nextdoor around like, oh, do you know where a new primary care provider is here, or an oncologist in this particular area? We just are not resourced to go in and manage that. Or, you know, God, it would be a full-time person to manage Reddit conversations and participate in those. But
incredible. I learned a lot. I really, really appreciate it. I know that we have only 2 minutes left. I guess I'm gonna give it back to the Austin and the team. But Michele, I really, really appreciate your time and the conversation. I really enjoyed it. It was wonderful, and I wish you all the best luck and success. Your team and you are just absolutely amazing. This organization is just incredible.
thanks so much. I enjoyed learning a lot more about Illumin as well.